Hi, welcome back to this Monday edition of Focal Point AFR Talk. 888-589-8840 is the number, 888-589-8840. And now from the There's Something Wrong with Everything files. There's something wrong with everything. That's my motto for what you discover if you listen to all these experts long enough. There's something wrong with everything. From the Something Wrong with Everything files, here's a story about mammograms. I mentioned this in passing last week, but you know, the meme out there has been you got to get a mammogram every year starting at age 40 because the idea is if you detect breast cancer earlier, the better. Well, a new study published in the British Medical Journal is raising questions about that conventional wisdom. Canadian researchers looked at data from the Canadian National Breast Screening Study, which recruited 89,835 women, 90,000 women, who were between 40 and 59 at the beginning of the study. They gave each of them a clinical breast exam. They assigned each participant to one of two groups, a group that would receive annual mammograms and clinical breast exams for the next 4 years, or a group that would receive only annual clinical breast exams for the next 4 years. In other words, no mammograms. So here's what they discovered. Over the initial screening period, a total of 1,190 breast cancers were diagnosed, 666 in the mammography group and 524 in the control group. So they detected more breast cancer in the group that was getting the mammographies, but the mortality rate was virtually the same. There was no difference in the mortality rate. During the 25-year follow-up period, 180 women in the mammogram program died compared to 171 women in the control group. So fewer women died of breast cancer in the group that was not getting the mammograms. If you look at the entire study period, 3,250 women in the mammogram group and 3,133 in the control group were diagnosed with breast cancer. The number who died, again, virtually identical, 500 women in the mammogram group compared to 505 in the control group. And then they said there was so in terms of longevity, in terms of the mortality rate, dying from breast cancer, basically no difference between women that had a mammogram every year and those that did not, just relied on the clinical breast exam. Study authors are asserting that about 1 in 5 of the breast cancer diagnoses made as a result of mammograms were over-diagnoses. So they were misdiagnosed, and so they were subjected, and it's very invasive, might be radiation, chemo, surgery, whatever, exposed to these very invasive procedures, and they didn't need them. So about 20% of the time, they were diagnosed and given treatments that they really did not need. Now, let's grab a Harry Reid quote. This is just an audio bite, but Harry Reid has been out there on the Senate floor saying that all of these horror stories, that you shouldn't believe any of these horror stories that you hear about Obamacare. Here's what Harry Reid said on the Senate floor.
Despite all that good news, there's plenty of horror stories being told. All of them are untrue, but they're being told all over America.
But all of them are untrue. Now, let me give you some of those. It turns out that President Obama almost scrapped healthcare.gov 2 weeks after it launched because it was so pathetic. It was so abysmal. It was functioning so poorly. It couldn't be patched. And so on October 17, the president actually asked his chief of staff, Dennis McDonough, this is according to Time magazine, can it be patched or does it need to be scrapped to start all over? So here's horror story number 1. Here's what Harry Reid says about that.
There's plenty of horror stories being told. All of them are untrue.
Now here's a story about callers who call these health exchanges and they face long wait times. Washington Free Beacon, Associated Press, long wait times of an hour or more have been commonplace in some states like California, Maryland, Minnesota, Nevada, and Washington. One consequence is that people just give up trying to get health insurance because they are unable to wait indefinitely. Here's Jackie Manley, who's been trying since mid-December to enroll in a health plan through the state's health coverage. She estimates that she has reached someone at the Maryland call center 3 out of about a dozen times, but she gets passed between different people, cannot get definitive answers to her questions. Here's what Harry Reid has to say about that.
There's plenty of horror stories being told. All of them are untrue.
Now, here is a story from The Hill from this morning that congressional staff, including congressmen and their staff, they've got a way to opt out of Obamacare that you and I don't have, and that is retirement. This may be one of the reasons why you're having so many people retire. Under a rule issued by the Office of Personnel Management, members and staff who retire will be able to revert back to health coverage under the Federal Employees Health Benefits Program. So they got all kind of choices under this FEHBP that are not available under Obamacare, and so that makes it attractive to retire. So the rest of us, the little people, get left out in the cold. The Congress people and their staff, they get special breaks. But according to Harry Reid,
there's plenty of horror stories being told. All of them are untrue.
Now here's a story out of Washington, their Obamacare exchange. They got 15,000 people right now in the state of Washington that are stuck in their exchange. They're just on hold. They're stuck. They're mired somewhere in the system. They can't get through to somebody. They can't get insurance. They've got no insurance. They're waiting for something to happen, and they are stuck. 15,000 in Washington's Obamacare exchange. But according to Harry Reid,
there's plenty of horror stories being told. All of them are untrue.
Now, here's a piece from dailycaller.com saying some of you that are senior citizens and are on Medicare Part D, Medicare Advantage plans and so forth, the Obama administration's new proposed rule for Medicare Part D would eliminate half of all Medicare Part D plans, half of them. And as I understand it, I'm not on Medicare myself, but I understand these are very attractive because of the choices that they give to people. Seniors love them because they have choices under the Medicare Advantage plans. Half of those programs go away, at least under the Part D. I don't know if that's the same thing or not, but the Medicare Part D, half of those plans are going away under Obamacare, and prescription drug premiums are going to go through the ceiling, are going to go up by about 20% for millions of American seniors, this according to a U.S. House Subcommittee chairman. So half the Medicare Part D programs disappear, prescription rates go up by 20%, but according to Harry Reid,
there's plenty of horror stories being told. All of them are untrue.
Now, President Obama back on October 21 read a letter from a woman named Jessica Sanford who was talking about how excited she was to finally get health care under Obamacare for only $169 a month. She lived in the state of Washington. Unfortunately, Washington State got back to her finally about her application. She was counting on a $452 a month subsidy. That was a mistake. The state of Washington said you get a big fat zero. So instead of getting insurance for $169 a month, she has to pay $621 per month, unaffordable. But according to Harry Reid,
there's plenty of horror stories being told. All of them are untrue.
And one last story, then we'll grab a couple of phone calls. Obamacare is threatening to end private practice. A lot of doctors being forced into networks and into hospitals. Dr. Tracy Regland, an independent primary care physician, is anxious about the future of her small practice. The law is bringing new regulations and payment rates that she says squeezes self-employed doctors. She cherishes the autonomy of private practice, speaks darkly of the rush of independent physicians into hospital networks, which she sees as growing monopolies. But according to Harry Reid,
there's plenty of horror stories being told. All of them are untrue.
Now, in the Mardi Gras float, apparently there are going to be 3 floats that have anti-Obamacare messages on them. 3 floats in the Mardi Gras parade at New Orleans. But according to Harry Reid,
there's plenty of horror stories being told. All of them are untrue.
Well, that's a tremendous comfort. You can rest easy. None of what I've told you is true. Let's go to the phones. Let's go to Jane, Glen Allen, Virginia. Jane, welcome. What's on your mind?
Hey, Brian.
Hey.
I'm calling you from beautiful, snowy Glen Allen. It's just gorgeous here today. I just had a couple of things I wanted to say. The first one is my unsafe friends always say to me, where is America in the Bible? Why aren't we mentioned in the Bible in end times? And I just want to say to all of your listeners, we're not mentioned because of what's going on today, what we're hearing today. And the second thing I wanted to say is my son, Travis, he's a 1992 graduate of VMI. He was over here over the weekend, and John Kerry came on the TV, and he was yapping about stuff. And my son turned to me and looked at me and said, "Why the long face?" Burst out laughing, and today, what Travis said to me has just carried me through the day.
Yeah. All right.
Went to VMI back when it was VMI.
Back when it was VMI. All right. Listen, I appreciate the call, Jane. Thank you very much. Last call today. Let's go to Nicole, Fayetteville, North Carolina. Nicole, welcome. What's on your mind? Got about a minute.
Okay, hi. Yeah, I just have a couple points. I'm just curious, all these religious films coming out, are the people that are actually producing these films, like, are they actually Christian, or are they just trying to get money off of all the Christians out here that feel like it's safe to take their kids finally to the movies to see something appropriate? It's kind of like I'm not buying into all of a sudden all these movies are coming out based out of the Bible. It seems like a ploy to just get money.
Yeah.
And,
well, and it's probably a combination, Nicole. I know that the folks that produced this Son of God movie, forget their last names, Downey and Barnett, husband and wife team, they are actually strong believers. They were the ones that produced that mini-series, The Bible. They wanted to make that accurate and true to the scriptures. And by and large, they've succeeded with the Son of God. There are some inaccuracies, artistic license they've taken at various places, but they genuinely are Christians that want to bring biblical messages to the screen. The guy that made Noah, he's just a big Hollywood producer, wants to make a bundle, and that's part of the reason why I think he took liberties that are going to be offensive to a lot of Christian moviegoers. All right, thank you, Nicole. I appreciate the call. That's it for today. Bow low before God, stand tall before man, stand in the gap, and never forget, you and I, we're fighting a winnable war. See you tomorrow.
The views and opinions expressed in this broadcast